Is fatty liver the gateway to hepatitis?
Fatty liver is an important cause for hepatitis.
How much of this is also, concerning when it comes to people who have diabetes?
Hepatitis B and C themselves are dangerous. And if it happens in persons who are already have other liver disease, of course they are concerned.
Alcohol and viral hepatitis. What is more concerning now?
Definitely should not neglect which one is a bigger problem. The awareness with regards to viral hepatitis is that this can be completely eradicated. Yes, alcoholism is also an important disease of the liver. It is also a preventable disease.
Hello and welcome to the News Minute. This is Real Talk, the collective, powered by Apollo Hospitals, Chennai. And here we are continuing our conversation on liver health. So, how much of this is connected to lifestyle? Is fatty liver the gateway to hepatitis, Dr. Kalayarsan?
Fatty liver is an important cause for hepatitis. But if you see the origin or the etiology, so both are different. Because in fact, the term fatty liver, it's they were in fact renamed as metabolic liver dysfunction. That's because it's a combination of multiple dietary factors and the lifestyle factors which contribute to increased deposition of fat in the liver, which by itself can lead to hepatitis and then progress to the next stage of cirrhosis.
Okay.
And even if you see Dr. Ilan, that's actually now becoming one of the important indication for liver failure and the liver transplantation.
These days, there is not just one reason for liver damage. There is a person who is having a little bit of fatty liver, has an occasional alcohol, and if he has a background of viral hepatitis. So these all accumulated risk actually accelerates the liver injury and damage, leading on to very disastrous complications. So I would say anybody with the background viral hepatitis, if he has other lifestyle related issues, if he has a poor diet, if he's overweight, if he's consuming alcohol, definitely that person is at a much higher risk than the person who doesn't have.
Okay. How much of this is also, concerning when it comes to people who have diabetes or people who are obese or people who have some sort of liver issues?
Hepatitis B and C themselves are dangerous. And if it happens in persons who are already have other liver diseases like fatty liver related liver disease or alcohol related liver disease, it is even more dangerous. So of course they are concerned.
Dr. Ilan, coming to you, alcohol and viral hepatitis, what is more concerning now?
See, definitely the problem of alcoholism is increasing in the society because maybe it has become more acceptable and the age of intake has lowered, and even there is a trend of people going for binge drinking. All that is directly harmful to the liver. But definitely we should not neglect which one is a bigger problem. The awareness with regards to viral hepatitis is that this can be completely eradicated. Yes, alcoholism is also an important disease of the liver. It is also a preventable disease. But we have, if we work as a society, we can eradicate these two infections, which is today a very major problem in our society.
Dr. Raja, can young adults also develop severe liver diseases or damages?
Yeah.
Because some people tend to say that, okay, we are young, so nothing will affect us.
No. I think we discussed this. So Dr. Ilan was mentioning about incorporating the vaccination at the early age. Because if you see, there are many young patients who develop the liver disease related to these viral infections because they acquire the infections at an young age. Even it can happen at the time of childbirth. If a mother is infected, then there's a very high chance, if there are no appropriate treatment measures were taken during pregnancy, there's a high incidence of what you call as vertical transmission, that is from mother to child. Anyone who acquires infection at such a young age, by the time they reach 20s, they would already had the liver damage and they can progress to either liver failure or the viral hepatitis liver damage related tumors.
Tumors, okay.
So it doesn't mean that age gives any protection. So the earlier the age you acquire this infection, you are at more risk because there's more time for the virus to multiply in your body and can manifest symptoms at an young age.
Dr. Raja, how much of a sedentary lifestyle affects your liver health?
In fact, sedentary lifestyle is now emerging as one of the important risk factors for various liver problems. You know that sedentary lifestyle is now associated with multiple metabolic conditions. Obviously, most of those people are obese, and that results in what we commonly call as the fatty liver, which is, in simple terms, there is excess deposition of the fat in the liver, which once considered to be a very benign condition without causing much problems. But now it's identified as one of the important risk factors, advanced liver disease, even progressing to liver failure requiring liver transplantation. In fact, that term also has been now recoined from simple fatty liver disease to metabolism associated steatotic liver disease. So there are various medical associations have come together, identify this as an important risk factor for liver disease.
Dr. Ilan Kumaran, I want to come to you because he spoke about liver transplantation. So when does a patient requires a liver transplantation? What is the stage?
See, liver transplantation, I would say, is one of the most advanced interventions in modern medicine. It is a very successful treatment and is needed for patients with liver failure or selected patients with liver cancer. So many patients have liver damage. They do not need liver transplant. Only when they start manifesting liver failure, which may be with the manifestation of jaundice, the fluid in their belly, blood vomiting, confusional states, any of these symptoms can signify liver failure, or if they're diagnosed with liver cancer, which cannot be treated with surgery alone, such patients, the liver transplantation becomes absolutely essential, and it is a very successful treatment.
What are the common reasons patients, reach end stage of liver disease?
So the most common reason is, of course, the alcohol-related liver damage today. Almost 50% of the people coming to our clinic with liver failure, still the reason is because of alcohol-related liver cancer. The second most important reason is actually the fatty liver-related disease. Somebody having fatty liver for 15, 20 years, they undergo silent damage and they end up in a state of liver failure. Then comes viral hepatitis. Because of hepatitis B and C virus, the liver undergoes damage and end up with liver failure or liver cancer. Even in very small children, there are some developmental disorders where the bile ducts are not developed and the liver gets damaged, or there are some genetic problems in the liver which leads to several life-threatening problems in the child. So all these people will need liver transplantation because of liver failure or other complications.
But Dr. Ravi, when they're getting diagnosed and treated, can patients live a normal life, or is there something that is going to change, forever?
If they have a liver failure.
Yeah.
So, yeah, there are
Or even a liver disease, like when you have a hepatitis or any other kind of liver damage.
particularly if they have a liver failure, usually they can manage liver failure and live comfortably. But only thing is they are very prone for complication. As Ellen said, some of them develop blood vomiting and they're very prone for infection. Every time if they develop a complication, their already weak liver become more weaker, and when we go to the hospital and get treated, the liver doesn't recover to the full extent. So they should avoid infection, and there are some food modification they need to do for getting rid of the fluid in the belly and leg. So many modifications there. They should avoid infection primarily.
When it comes to, liver transplant, what are the common myths that surround the organ donation? Like, even myths about liver donation.
Heart-touching story where, mother wants to donate the liver for a child. When the child needed transplant, we explained to the family. They all understood. They were coming out for transplant. And the mother, after all the discussion, she just came and said, "Sir, after the surgery is over, can the father take care of the child? Said, why you are there to take care of the child? She said, no doctor, I am giving liver, then how will I be there? So even such deep myths are existing where people think by donating liver, your life is at a risk. And it is very, very important for a medical team to ensure the donor safety as the prime and most important thing in living donation. And almost 50% of the people who get screened for liver donation get rejected because of simple reasons like excess fat or even other reasons like inadequate liver tissue, difficulties in the structural arrangement of the liver, or some people have systemic problems like heart disease or a kidney issue which may not be safe for them to undergo a surgery. All these people are rejected. Only when all the investigations show that it is safe to undergo a donation, they are accepted for liver donation. So this is one of the common myths. And second is with regards to liver transplantation, the matching of donor to recipient is very, very simple. Blood group matching itself is more than enough. And anybody with O group can donate their liver for everyone. And anybody with an AB group can receive the liver from all other blood groups. And rest of it is the same, A to A, B to B. So apart from this, no other matching or any complicated procedures is required. So this is one of the major understanding that people have to know, that liver donation is a very, very straightforward and simple process. And finally, with the advent of minimal invasive donor surgery, it has become very beneficial for the donor in the sense that the recovery has been very quick and the long-term complications like hernia, obstruction, they all become very less common. And so the donor pretty much leads a completely normal life almost 1 month after surgery.
Dr. Raja, what are the kind of advancements that have come into liver transplantation in India?
I think the one of the key advancements which has happened is with respect to the reducing the donor morbidity. Otherwise, as you are aware, majority of the liver transplantations in India, as Dr. Ilan mentioned, also is living donor liver transplantation. So where the liver is donated by the family members, and most of those donors are the young people, young healthy people. So in them doing a major open surgery does affects their long-term functional outcomes. So the advent of minimally invasive donor hepatectomy, either by a laparoscopic or robotic approach, is a really important advancement in the field of liver transplantation. And the other major advancements are with respect to, as Dr. Ellen has mentioned, the liver donation is almost similar to blood donate. With respect to the who can donate to whom. Okay, the tests are very simple. But you can still, if there are no suitable similar matched donors with respect to the blood groups, you can still donate, and there are methods available to improve the outcomes even when the livers are not blood group matched.
Okay.
Yeah. So these are some of the major advancements which have happened in the field of liver transplantation.
So there is this one question that is bothering me, which is a common belief, everywhere it's the same. Like if you have jaundice, you don't have to go to a doctor. There are, not to marundu, country-made, medicine and treatment methods. And this question is to all of you. As in, what has been your experience when patients come to you? Immediately they would have gone to a nearby doctor. They would have gone to someone, some other forms of treatment. What has been your experience, and what has been this the myths about these kind of treatments?
Shibi, first thing, jaundice is not a disease. It is the manifestation of a disease. People think jaundice is the diagnosis, but jaundice happens to be a symptom. It can happen because of liver disease, which is a liver damage, or it can be because of a simple gallstone getting blocked in the bile duct, or it can be because of tumors obstructing the biliary pathway. So the first thing somebody with jaundice needs to know is what kind of jaundice is it. Is it an obstructive jaundice or is it a liver-related jaundice? Because the treatment varies completely. It is completely different. A simple obstructive jaundice, maybe it needs only a endoscopic procedure, or it may need a surgery, or if it is a liver-related jaundice, it may need only a medical treatment. But fortunately, most of the people who are having jaundice is because of this infection called hepatitis A virus-related infection, which is a self-limiting illness. You get a cough and cold in patients who have stones. They continue to take this native medicine. Jaundice gets worsened. Sometimes they land up with severe infection and multi-organ failure. Or if they have a tumor, they land up in a stage where the tumor is already spread to multiple other places after having taken weeks and weeks of native treatment.
Doctor, your experience, and also I want to ask you about this fish treatment, then Kiwanalli Kirai treatment. Is it all something that will work?
Even I had the treatment when I was young because as I think the key message you already got.
Yeah.
Always find the cause for jaundice before treating it. Unfortunately, it doesn't happen many times because the moment jaundice we go for those treatment, because majority of the jaundice are caused by hepatitis A, and since as Dr. Ilham pointed out, it kinds of gets cured in
Automatically.
automatically. So that's why the faith in those treatments, like whatever you mentioned, is still increasing because a good proportion of patients get cured after that. It's probably because they have hepatitis A, and the treatment, the cure was not because of what they received, it's because of their body itself cured it. So
sometimes they land up with what we call the CAM injury. These treatments are called complementary or alternative medicines. The thing would have gotten healed by itself because of these treatments gets aggravated.
Thank you so much, doctor. It was wonderful interacting with you. Thanks again, once again.
Thank you.
thank you.